Hello, everyone, and welcome to today's webinar on trimming accounts receivable and growing your profit. Today, we will have presenters Ann Geier, Vice President of Clinical Informatics at SourceMedical, and Becky Ziegler-Otis, Administrator at the Ambulatory Surgery Center of Stevens Point, Wisconsin. Becky will be sharing her perspectives as an administrator on the benefits of outsourcing billing services. And Ann will be bringing her perspectives as a longtime administrator among the ASC environment. Ann?
Questions. We're going to be doing this in a conversational mode, so I'm just going to be talking with Becky. Becky, welcome to the webinar. What were you...
Ann, I apologize. It's Kathleen. I think we had problems with your audio for the first moment you were speaking. If you wouldn't mind repeating yourself?
Oh, I'm sorry. Okay. I said welcome to the webinar, and what we're attempting to do today is to present revenue cycle solutions to you through the eyes of a user, someone who's got it and they've implemented it in the center, and Becky has graciously agreed to do this with us. So Becky, welcome. Can you start out by telling us about your center at Stevens Point?
Sure. We're a freestanding independent surgery center, and we're located in central Wisconsin. We do approximately 110 cases a month, so we're not real big, but we are multi-specialty. And the specialties we have are orthopedics, which represents between 40 to 45% of our practice. We also have about 20%, which is pain injections, another 20%, which is our ophthalmology, and then the remainder is urology, podiatry, general surgery, and spine. And I also think we're an aggressive surgical center, and actually we started doing our overnight joint replacements back in 2010, and we've done approximately 50 of those so far.
So you're really doing quick turnover cases like ophthalmology and pain, in addition to some pretty significant more acute patients, like your total joints.
That is very true.
Okay, which makes coding a challenge, I'm sure.
Well, it does, and that's why utilizing the aspects of the coding billing company has been very helpful, because try to become an expert in all those areas is very difficult.
It is difficult. What version of SourceMedical software are you using?
Currently, we're using the SourceMedical Vision, and we actually started using that in January of 2008. And we're using the scheduling and the demographic portion. We haven't been one of those that have evolved onto an electronic health record yet, so we don't have that portion, nor do we have any electronic health record. Just
okay,
the Vision.
So you've been using Vision for about 6 years.
Yes, that's true.
Okay. What prompted you to start looking for a different way of doing things?
When we first opened in late 2006, early 2007, we had actually decided we were going to use the physician's office, which is right next door to us. They have the orthopedic practice, and it was thought, why not use those individuals to do our coding and billing for us? And so we started with that as our mindset, thinking, well, they would have the knowledge and the expertise and the time to be able to help us. Well, we learned pretty quickly that actually things were not working well, and we were watching our accounts receivable climb, and actually when they hit 100 days and there wasn't the revenue coming in, we knew prior to then, before hitting that mile marker, that we actually had to do something. We learned that actually the coding billing staff at the clinic, though they tried really hard, they were experts in doing the physician practice coding and billing. But that doesn't mean that they were experts at doing the surgery center facility coding and billing, doing the modifiers the right way. They also knew their contracts real well, but weren't real familiar with what our contract said. And so we saw that AR climbing, and we knew that we had to do something different.
How long had you been open before reality set in?
We had opened in late 2006. And through 2007, we began to see the AR climbing, and we knew that something had to be done probably the fourth quarter of 2007, and then we actually made our change in 2008, right away at the first of the year.
What prompted you to look at revenue cycle solutions?
We actually looked at a variety of different billing companies that we would want to use for our coding and billing services, but there were a couple things that enticed us about that one. The first thing that we liked is that they specialized in just ambulatory surgery center coding and billing. We knew that that's what we wanted, particularly from the experience we had with having a physician's office practice doing it. We thought making the transition to someone that was an expert in that area would be very helpful. I knew that I didn't want a vendor that had any offshore activity, so that was also very important to me. I also was looking for a company that used certified coders, and one that I could trust was going to, be sure that they were training their coders accurately and that they were competent in what they were doing. So with all of those factors in mind, that's what I began looking for. I did a variety of reference checks before I selected a billing company as well, so I went to different individuals that were using companies, asked how it was working for them, and through all of those different things, made my selection.
You went through a very thorough process. I'm impressed. How quickly before you saw a change between your old practice and going with RCS? How long a period of time before you saw the numbers start to change?
I would say within the first quarter, we saw the numbers start to change. You have to be patient as you start this process. It's not going to be immediate results. You're training new individuals what your contracts are. You're showing them how you like your practice to be handled. And so that all takes time, and I wanted to make sure we did it right. At the time, we set up a lockbox so that the billing company could access the information as it comes right into us from another off-site source so that they could start gathering that information. I worked very closely with the individuals that were doing the collections. I wanted to make sure that our patients were handled the way we wanted them to be handled. And so I wanted to take the time to do it right. And what I mean by that is we're a small community. So I'm going to run into people at the grocery store that might be patients here. And I don't want them to say, oh, my, I wasn't handled very, very nicely by your billing staff. I want them to have the same feeling that they get when they come into my surgery center as a patient. And so it was important that I worked with the billing company to make sure that they would follow that same culture that I had. So once we had that underway and they were doing the billing, I would say we started to get results within that first quarter.
That's amazing. And the customer service aspect of that's important, too. Every community has its own culture, and I understand totally what you're saying about you do see these people out on the street, and if they've had a negative experience, it's not good for you.
And that is so true. That is so true. I mean, you want them to be an extension of you.
Absolutely.
It works out very nice, too, Anne, in that we sometimes will have ways that we kind of bounce off of each other. Like I may have my person from the billing company call and talk with a patient about a payment plan, and they may not like the results, that they're hearing from that person. And then they'll call me, and I'll intervene, and we sort of work together, sometimes kind of like the good cop, bad cop scenario. And I think that works really well as well because you've got two people working on it kind of from a different perspective.
Well, it's like being in the same office space, except you're really not. But because you're all on the same page, it functions as a team.
It is true, and I actually don't even look at the company as being like the billing company. I don't even think of it as that way. I've been working with many of the same individuals since we started using the service. So we started in 2008, and I have several of the same employees that are still working with me. And I think, that talks about the ability for the company to retain, good individuals. But it also helps me because they know how I think. They know how I like to set things up. And so it's worked out real well that way as well.
That's great. Now, you are a small center. Describe were you able to decrease any employees by going to Offsite, or not Offsite, but using RCS, or tell me how that impacted your FTEs?
Well, I don't know that I totally reduced employees because initially we were actually using this outsourced billing company. So we were going from one company to another company. However, I did not have to add staff as we started to grow and do the different billing functions.
Okay.
Also, I'd say I had an individual that was doing medical records work, and I was able to kind of convert her into doing more of the insurance verification, doing that more, definitely up front, which we weren't doing before, but that actually dovetailed well in with the company's activities that we were working with, too.
Okay. Well, can you tell me just briefly how the process works. I mean, you do the surgery, then what happens? At what point does RCS pick it up?
Well, they pick it up the next day already. Once we do the surgery, our doctors actually do their dictations on the day of surgery, and then they get transcribed the next day. We actually then fax, or in some cases we scan and email the operative reports to the billing company, and that starts the whole process. They do the coding. Some of our doctors actually like to do their own coding as well, and so if their coding differs, and I share that information with them on another form to the billing company, if their coding differs from what the coder wants to use, we take care of that. She sends it back to me, and I have the doctor take a look at it. That piece right there provides great education to our doctors, because many times they're not dictating the right thing, and so she'll help them out with, this is what you need to dictate so that I can code it properly. So anyway, the coding occurs at that point. Once that happens, then the bill drops, and then they do the follow-up. They send the bills directly to the insurance company. They follow up within so many days to make sure that we're getting paid. If we're not getting paid, they'll many times call me and say, you know, what else can we do, or I help them in some ways. After the insurance company has billed and paid, then it drops down to the self-pay balance for the patient to pay the remaining balance. Once again, I get involved if needed, if they're having trouble with collecting from the patient. So they're involved right away from the beginning through the whole course.
Are you mostly collecting your co-pays and co-insurance prior to surgery?
We are. Initially, we were just doing the co-pays prior to surgery, but just recently we have also started collecting some of the co-insurance, maybe not all of it, and that just is due to the, the large number of high deductible insurance plans that we're seeing.
At what point, and were you able to measure the increase in collections? Were you able to start tracking it where you came up with numbers that you could present to your owners?
We started tracking that right away, and of course they wanted to know how this was going to work. One of the things that I really like from the company is they provide me with a monthly report, and that monthly report it's like a dashboard of information about my accounts receivable. And so in that, what I would call dashboard with all those different metrics in it, it tells me how, where is my accounts receivable as far as days. And so I was able to watch that go down month by month. And then in addition to that, it tells me what percentage of my AR is in the various buckets. So what percent is in the 0 to 30 days, the 30 to 60, the 60 to 90, and of course anything over 120 days. And so I can watch that and intervene where I need to. The other thing that's a part of that report is it tells me which insurance company is holding up the AR. It tells me how much is in one insurance company's. That's great. Those are great metrics that I followed right from the beginning, and that helped me, continue on with the successful, entity that we have.
That is good. What are your current AR days running? You started about 100 is when you noticed the problem, and then where would you say you are today?
I would say today we range in the 40s, sometimes low 40s, sometimes we even dip into the 30s. But I also count that, I have to say that we have a large orthopedic practice, and so sometimes collecting those dollars, with those various implants and whatever can be difficult. So I'm very satisfied with where our AR sits. Okay. And I also look at the like what accounts or what percentage of my AR is greater than 120 days. And I'm very proud of that number because that ranges between 6 to 8% consistently. And that doesn't mean we're writing everything off to collections. It just means that we're collecting that revenue quicker.
A lot quicker.
Quicker.
What is your payer mix? Do you have an idea? Like, is it Medicare, Medicaid? Is it mostly commercial? You do ortho? Do you do workers' comp? Just give us a picture.
I would say, annualized, if I took a look at it, my government payers are probably, they range between 30 to 35, sometimes hit 40%. Okay. And then a big portion of the rest is commercial, and I would say maybe 4% is workers' comp. So predominantly commercial. Okay.
So you mentioned earlier, and this is something that interests me, if you have a problem payer, it becomes obvious pretty quickly. What have been your solutions to fixing that? If they're famous for stall tactics, but what do you do when that happens? Does RCS help you with that, or?
You know, absolutely RCS has helped me with that. First of all, it's pretty much my person that I'm working with who will say, Becky, we need to do something about Blue Cross Blue Shield or whatever company it might be. And so what we have done is, in one case, we actually set up weekly meetings with our provider rep from that insurance company. And we put all of our claims that we were having problems with, tried to come up with the trends or patterns, and then with my representative from the billing company and myself, we would do weekly phone calls with this individual to hold them accountable to resolve the issues, you know, going forward, and then to take care of the outstanding ones. So that's one of the tactics that I have used in the past, and that's been very, very successful.
Well, that's good. You also mentioned billing for implants, and of course that requires dropping hard copies with the invoices. How does RCS help you with that?
Well, what we do is when we fax them our operative report, we also have to fax them our implant invoice. And then they are able to take that and attach it to the bill itself and send them out together. So we provide them with the data that they can use for the billing. Okay.
Now you mentioned they work the collections, they do the follow-ups, so they know all of your contracts. Is that correct?
That is correct. They have actually information on all of our contracts, and that's one of the things that I very much appreciate that I know we didn't get in the beginning when we opened up. They manage my contracts very tightly. We have changes that happen here and there, and an example I'll give is just recently we had a number of claims from an insurance company that they actually paid us at the 2013 rate versus the 2014 rate. Mm-hmm. And they picked up on that very quickly, made sure that we went back in and are appealing and gathering that additional money. So they manage those contracts very tightly. If, in fact, we don't get paid adequately, and it should be within the contract, they're also not afraid to, you know, take it to the state level, to go to the, you know, the utmost level of appeal to make that happen.
So they treat those payments as if they were their payments.
No, absolutely. They are very much invested in making sure that my accounts receivable is where I want it to be.
Do you do any out-of-network billing, or are you in-network with everyone?
We don't do any out-of-network. We're just in-network billing.
Okay, because I know that RCS works with out-of-network payers, so I just wanted people to know that you don't have to be in-network with all of your payers in order to use RCS. Well, you've said a lot of good things about the program, but what would you say you like best about it?
Well, there's so many things that I really enjoy about, you know, having them help me out. I think the first thing that I really enjoy is having them be an extension of my company. And I guess I wouldn't have expected that when I first started out. I always thought it would be referred to as like the billing company, but it's not. And when those individuals call and they'll want to talk to me, my collector or whatever, it's almost like an employee that, you know, they go get them right away. Oh, Becky, so-and-so is on the phone. You need to talk to her. So they have become an extension of us, which I think is wonderful. I also like that I can ask them for different ways of doing things. They advise me if I need assistance on different things. For example, if we're going to start some new spine type procedures here, and I don't know what the CPT code is, I want to make sure that it's within my contract so that I can get paid properly. They'll help me out with that. They'll help me out with what documentation that doctor needs to put in that report so that we can make sure we get paid adequately. They can help me out with, you know, when I have questions about, can you help me with, you know, co-pays? Give me some language that maybe I can use to make my billing staff feel a little bit more comfortable, or my office staff feel a little bit more comfortable when they're asking for the co-pays. So I've gone to them for advice, and they have been very, very helpful. So I think that's great.
And you mentioned, go ahead. All right. No, go ahead.
Yeah. I think the other thing that I really like about having them is I think about having my own staff here, my own billing staff in-house. We're a small company, and people are doing things that are outside of their core responsibilities all the time because we have to get the work done. And I like the fact that I don't have to worry about my billing person being pulled to do a check-in or being pulled to, you know, water the plants or whatever it might be. They're actually, you know, not being pulled to do those things so they can devote their total time to doing the billing and the coding.
No, that's true. That's very true. I don't know if you know this. You probably do, but at the RCS offices, they have what they call a quiet floor, and it's a whole floor dedicated. You don't hear people talking. There aren't people on the phone. It's a quiet floor. You go downstairs, and that's where the phone calls are being made to all the payers and all. But it's really, I mean, you can almost hear a pin drop upstairs because they want them to concentrate on what they're doing. So you get their undivided attention. Now, you mentioned that you had trained your medical records person to do insurance verification. Is that correct?
That's correct.
Okay, so you're doing that in-house. But RCS also can do that. So if anybody's interested in the whole package where they start at the beginning and do insurance verification, RCS can actually do that. So you sound like you're very pleased with this. Let me ask you the other side of this. What changes would you suggest?
You know, I can't think of any changes that I would recommend, and it's really worked well for me. And so I can't think of anything that I would change. If I had to do it all over again, would I make the same decision? Yes. Would I choose the same company that I chose? Yes, it's worked out very well for us. I'm just very satisfied. So I honestly can't think of anything I would change.
Okay. You think that this would work equally as well for a large multi-specialty center, say one that has 4 to 6 to 10 ORs and already has a large business office staff? Do you see this applying to them? And what impact would it have, in your opinion?
Well, I think it definitely would apply to both a larger as well as a smaller place. And the impact I think it would have, it would definitely affect, you know, the accounts receivable. And why do I say that? I think there's also another piece to having your own internal staff, which was problematic for me, and I think it would be problematic for any surgery center, and that has to do with staff turnover. Whenever, you know, let's say you would have a biller or a collector resign, you've got some training time. Well, first of all, you've got to find a person. Then once you find them, you've got to get them trained and in place. You've got to have that work environment all set for them, you know, to work in. You've got to do the education, the training. So I think being able to just, I don't want to say not worry about it, because you still worry about your accounts receivable and your revenue stream, but I think being able to outsource it would even be a greater benefit for a larger place, just because you don't have to worry about all those things. You're busy enough with all the other clinical activities you have to maintain.
Absolutely. Well, one of the comments you mentioned was people not being interrupted. And business offices are busy, and everybody wears multiple hats because you have to cross-train them to do other people's roles in the billing office for the very reason you just mentioned. People are out on vacation, people quit, people get sick, and someone has to know how to do their part of the job. But if you're in a small community, you can't always find good people to do that work. And then the learning curve is pretty significant. I had someone at one point that was a collector in a surgery center, and I say this because you don't, sometimes we're putting square pegs in round holes. I walked by her desk in the billing office, and I heard her telling a coworker, I really don't like asking people for money. And I stopped and I said, but you're the collector. She said, I know, but I've never liked doing that. Well, if you think about how that comes across on the phone when you're talking to a patient and trying to tell them what they owe, they get that message that, you know, and they can sometimes manipulate you based on the fact that they know you're not comfortable asking for money. Well, is there anything else that you can think of that the people listening to this webinar would like to know? How do you think the cost-benefit ratio is for this? I mean, I know it costs money. Has that been offset by the benefits?
Definitely, it has been offset by the benefits, and I regularly take a look at that because I could employ so many individuals, put them in an office space here. I mean, there's different ways to kind of look at, you know, what is best for your entity. And I guess I would challenge everyone, take a look at what it costs you to do it now internally, and also take a look at it of where your, you know, where your AR stands, and are you happy with where it is? And then, you know, counter that with taking a look at what would it cost to outsource that activity. And there's also the cost of getting that revenue flow coming in regularly. There's the benefit of that. So I think if you kind of take a look at it from, you know, the perspective of, you know, just because you're doing it in-house doesn't mean it's the most efficient. And it doesn't mean you're getting, you know, the most out of it. Take a look at, you know, what the outsourcing has to offer. And I also don't think, you should look at it from the perspective that you're going to get immediate results right away. So if you decide to outsource, don't set your expectations that 2 weeks later everything's going to be great. That's not how it works. I mean, you have to be patient. You have to work closely with the company, make sure that, they're following what you want them to follow. But eventually you're going to get out of that reactionary stage, and you're actually going to be in one where I think the AR will be flowing nicely, and you can be using them for more education and information that you can use. So it's really kind of a collaborative team that you end up with. And I guess in summary, it's worked out really well for us, and it's something that we're going to continue to do.
Well, I appreciate your comments on that. And we'll get back. We'll have questions from the listeners in a few minutes. I want to introduce people to a partner that SourceMedical has, LeClair, and they provide analytics in the software system in their program. And this is just a screenshot of one of the reports that you can get from LeClair. This is from a demo center, so the numbers aren't necessarily real, but it gives you an idea of the aging claims, when were they last worked, the average monthly charges and trends, average cost, case costs and trends, et cetera. And it's all in a snapshot picture. Where you see click for details, as a manager, you could click on that and you'd get a report similar to this, aging claims worksheet, and it gives you all this information that you'd want to know. LeClair has a webinar that's available for your viewing. It's got one thing that I truly liked when I watched the webinar, and that was that when you're working as a manager, as the administrator, and you're trying to see what's going on in your billing office, is that you can run so many different reports, but the information you need to do a snapshot's all available on one page. You can see patient registration, you can see the payers, you can see the accounts receivable, whatever it is that you're looking at, and it can be for one patient located on one page. And it really saves you the toggling back and forth to a lot of different modules trying to get the information that you need. So if anybody's interested, please see your SourceMedical rep, and they will be happy to talk to you about this product. And all of today's attendees are eligible for a free AR analysis, and just complete the form at the close of the event. I'm going to toss this back to Kathleen for questions.
Thanks, Ann, and thank you so much, Becky. We really appreciate hearing your perspective today. We have had a few questions that have come in from our audience, so I will address them to one or the other of you, maybe both in some instances. But let's start with one for Becky. We have a listener today who would like to have you elaborate a little bit more on how you know what is going on with your billing. What sort of reports or conversations or input are you getting from the team that's working with you on your billing?
I would say there's probably two pieces of information. One would be the day-to-day interactions that I have with my billing company, and you may not want those interactions, but I enjoy that. So I encourage them to call me if they have questions. And so just little things tell me that they're doing things the right way. And what do I mean? I mean, I might periodically check a couple of, EOBs on what we got paid, and I see that actually I know myself that maybe we weren't paid adequately, and I know that they are doing the follow-up. I can see the notes in the system. Also, they may get a call from a patient, and they want to develop a payment plan, but it's not enough money, and they call me and seek my feedback on that. So it's through that day-to-day interaction that I choose to have with them that makes me feel like things are going well. But then there's the hard data piece, and the hard data piece is the monthly report I receive from them. And so I can see in that monthly report, where are the AR dollars? I can tell that by not having many dollars stuck in that 120 days or greater bucket, that things are going smoothly. And if I even want to, find out actually what patients are in these individual buckets, or where is the money being held up by patient, by insurance company, I'm able to find that out. I can ask the questions, and they give me the answers that help me dig. So I can see both, the interaction piece, the day-to-day interaction, and I also have the data that supports that it's going well.
Thank you. Great. Ann, did you want to add anything to that?
No, I think I know personally from having been down to where all of the work is done that they really do maintain a good relationship with their centers, and they do talk with them often. And the fact that they have very little turnover, Kathleen, is huge, because in this day and age, people don't stay in jobs very long, and especially in a job like this, if you went through a steady stream of turnover, it would be very difficult for the administrators who face this every day, and they're the ones responsible for the money.
Right. And on that point of turnover, we've had a couple of questions about the coding part of the process. The question came up, who does the coding? Are these certified coders? Do they have ASC experience? Ann, do you want to address that one?
I'll be happy to. They use all certified coders, mostly with ASC experience, and they pair them with the center's needs. So if you do a lot of orthopedics, what I saw when I was there was that they had coders that did mostly orthopedics. So they knew about the orthopedic, the codes, they knew about implant billing, they knew about workers' comp if it had to do with, if it was a workers' comp orthopedic case. Basically, they paired the specialist as much as they can with the centers. Coding for an ASC is not the same as coding for a physician practice. There was a thread on ASC Connect this week about someone wanting to have the physician's office do their coding, so it was interesting to me to hear Becky say that they started out with that. It doesn't work. It's not the same. And then whose interests are they going to serve? They're going to serve their interests first. So say there's an unmet deductible, they may be interested in dropping your claim first because the deductible will hit the surgery center. Therefore, the physician's practice will get paid in full. So there is a conflict of interest there. But the coders at RCS are certified coders. They're good at what they do, and they have every updated resource you could have at their fingertips at every single desk. They have the professional coding manuals. They have the ICD-9, soon to be ICD-10 information at hand, and they refer to it all the time.
Great. Okay. We've had some questions about software. One of the listeners has asked, is SourceMedical software necessary to take advantage of the ASC billing services? Ann, can I throw that to you?
Yes, and my question there is you would have to go back and check and see. Let me see if I can find an answer to that real quickly. That came up this week, and I had another client ask us that. I don't believe that they have to, but there could be a conflict. It's easier if SourceMedical software is being used.
Yeah, in fact, the SourceMedical software is the optimal platform for the billing services, but as I understand it, we can make that software really affordable under a billing services agreement.
I think that's true. I think it's just the way that it's structured and how the contract is put together.
Correct, good. Okay, we had some questions about benchmarking and and Becky, this may be a question for you. How have you been able to tell over the years that you've been using ASC billing services, also known as RCS, how can you know that they are doing a better job than any prior billing service, outsourced billing service that you were using?
Well, I guess I can tell by the results that I'm seeing in my accounts receivable picture is what I would say. And as far as benchmarking, I actually take the benchmarks that come out from Becker here and there and look at that Intelli Marker. They have a lot of benchmarks as it relates to accounts receivable, what your days should be, and how much should be in those individual buckets that I described earlier, 0 to 30 days, 30 to 60 days. And so I benchmark my numbers on a monthly basis, making sure that we're hitting those or are better than the national averages.
That's terrific.
Kathleen, that Intelli Marker that Becky's talking about is the VMG Intelli Marker. It's free. It's downloadable from Scott Becker's ASC review. The most recent is from 2011. It's a very big file, so someone that does it just needs to be prepared to either put it on a disk or save it to an external hard drive. But it's got everything under the sun in the Intelli Marker that you could want as far as benchmarking your business practices.
What a great resource.
It is a great resource, and actually, you know, something that might be easier than even just downloading that is if you just go to that Becker website and sometimes just click in benchmarks for accounts receivable, they're always putting little blurbs out there, and you might be able to find it even a little faster. I have the full file, but sometimes when I want something pretty quickly, that's what I do, is just go to the website, click in what I'm looking for, and I'll get these little articles that they submit here and there.
Now, that's an excellent idea. That's true. Can I clarify something? We were talking about whether SourceMedical software was needed in order to use RCS, and I got the response from one of our senior executives, and he said, yes, you do need SourceMedical software. I just wanted to clarify that.
Okay, thanks, Ann. Appreciate that. All right, I want to be respectful of the time that we have not only from our presenters but also our listeners. So if there are any remaining questions that folks would like to send in to me, I'll keep the chat interface open a little bit longer. I've been inviting in questions via the chat all through this session. And if there are answers that I'm able to get from either Ann or Becky or some of the senior people from SourceMedical, we'll make sure we include them in follow-up FAQ documents. But thank you again to our presenters, and thank you to our attendees. We hope you enjoyed today's session.
Thank you.
Thank you.